25. Hello, everyone. Welcome. I know it takes a few seconds for folks to officially join us in the Zoom room, but we're so glad that you're here. I'll go over just some STEP basics. If this is your first time joining us, welcome. I'll tell you a little bit more about the STEP program and what to expect before we get to the bulk of our presentation. We also have some exciting sessions and things coming up in these next few weeks. So I'll spend a few moments here and allow anyone who's coming in late to not miss our main content, and then we will get started. So welcome to STEP, everyone. My name is Tessa. I'm our Assistant Director at the Triton Transfer Hub. And if you're just joining us and you haven't already registered for the STEP program, please. It's just step.ucsd.edu, and that will take you to our whole programs page where you can register for our in-person sessions we have coming up in just 2 to 3 weeks. And then also ensure that you're getting the emails after each of these sessions with the recordings and the notes that who's on screen with us, is taking so diligently behind the scenes. So if this is your first time, you're in one of our transfer talk sessions. These are every single Wednesday at 3 p.m. with the exception of next week. We are taking off for the holiday. And they are on need to know topics or frequently asked questions as you're transitioning into the university. Today is going to be about your health, as well as the UC SHIP plan. Some of the ones we've had in the past that are up on our website recorded are financial aid, advising, transcripts, and IGETC. So we really try to cover the things that you need most as you're transitioning into the university. You'll see at the bottom of your screen too as we go that there's a Q&A box. Everyone who's in the room with us is an expert on health, but they may not know things about advising or parking or other areas on campus. So if we can try to keep our questions mainly to the health topic for today. Coming up, and we've already started with our first, we have some Transfer Connect sessions. So these are intended to be more social. You have the opportunity to be in a real Zoom or in person and get to interact face-to-face with some of your fellow incoming transfer students. We have an in-person one coming up in July. And if you're military connected, whether that's veteran, dependent, active duty, ROTC, we have a session tomorrow for all of our military connected folks in collaboration with our Student Veteran Resource Center. So hopefully you can join us for that. Here are some of those things that I just mentioned. We'll also have our first in-person session. This is the only thing that you really have to make sure you're registered for because we'll cater food. We want to make sure we have lunch on the table for you if you'll be joining us in person on July 10th. And then went ahead and sent those registration links in the chat there. I'm going to pass to Elizabeth to, I am not screen sharing, so thank you so much for the heads up there. I've gotten too confident for doing this in 3 weeks, but here next I'm going to pass off to my colleague Elizabeth, who's going to talk a little bit about her research and involvement series, which is starting in just 2 weeks.
Yeah, thank you, Tessa. So research and involvement series will be hosted by me. My name is Elizabeth. I'm the research and involvement coordinator at the Triton Transfer Hub. So what I do in my role, I connect transfer students like you to research opportunities. We talk about how to cold email professors, what kind of research opportunities are available at UCSD, maybe on or off campus. And so I'm going to be hosting a series of 5, and we got some really good topics. So the first one will be in 2 weeks from today. Well, actually, that will be a transfer talk. But once we get to that transfer talk, it is going to be in a little bit more than 2 weeks. We'll have our resume workshop, and so we're kicking it off very soon. So I highly recommend joining the research and involvement series if you are interested in, learning about how to get involved with research, how to talk to professors, and then other stuff as well. So yeah, and I will hand it over back to Tessa.
To Ali to share about her series coming up later this summer.
Awesome. Thank you. Hi everyone, my name is Ali Shanley and I'm a transfer retention specialist with the Triton Transfer Hub, and I'm super excited to be hosting a transfer success series all about how to thrive academically and holistically at UCSD. And so with my series, which is kind of taking place towards the end of summer, We'll be learning about academic success and how to transfer your current skills and studying strategies and how to make the most of those coming into UCSD, whether that be from your community college or for your institution. There is a lot of good experience that we can leverage that you already have available to you. And so that will be really exciting. And then we're also going to deep dive into a variety of strategies that have come from current UCSD transfers on how to enhance your academic well-being. And that will be a really holistic approach to what that really means. So making sure that you're taking care of sleep and balance in your schedule. And I'll actually be partnering with Haley, who's here today, for one of those presentations. So super excited and really excited to have you all start and hang out with us in the fall. Thank you so much.
And with that, thank you all for being here. We are going to pass to our folks over in health. So we'll share our SHIP slides to get us started. And are y'all seeing the presentation screen, not just the window with all the slides? Wonderful. Thank you so much.
Thank you, Dessa. Hi, everybody. Good afternoon. I'm Jill, the insurance manager at Student Health. I'm here to share important details about UC San Diego's health insurance requirement. I'm accompanied by May, who will be answering the Q&A box while I'm providing the slides. UC San Diego requires all students to carry comprehensive health insurance as a condition of enrollment. This fee is built into student registration charges and recurs each quarter you're enrolled. If you'd like to join the student health insurance plan, which we refer to under the acronym of UC SHIP, no action is needed. You're automatically enrolled when the fee is paid. Already have insurance? I'll explain how you can submit proof and avoid paying the health fee. So what is UC SHIP? UC SHIP stands for the University of California Student Health Insurance Plan. Ours is underwritten by Anthem Blue Cross PPO, and it is a student division coverage not sold commercially or to the public. It's tailored and designed specifically for undergrad and graduate needs with input from student communities. It's comprehensive coverage that offers high quality, affordable care that helps protect against unexpected medical expenses. If you live near or visit another UC campus, you can use their student health services just like you would here. We also provide worldwide coverage, so if you're thinking about doing a study abroad program or global seminars, our plan has you covered. For the fee for undergraduates for the 25-26 school year, and it does go up each school year, for this year, incoming undergraduates will pay $987 per quarter, and graduates will pay $1,940 per quarter. This is billed for fall, winter, and spring also covers summer. For a detailed breakdown of benefits and coverage, please scan the QR code provided. It will direct you to further information on our website. This is a picture of our student health clinic on campus. It's located right on Library Walk, right down from the Geisel Library. If you want to find out more information about the student health clinic and the providers that we have, please click on the QR code and it'll take you to their resumes and what we offer in our clinic. All registered UC students are welcome to receive care at Student Health for both primary care and urgent care needs right here on campus. Our clinic is open Monday through Friday year-round. If you're covered by the UC SHIP, the Student Health is your primary care home. This is where you would start care if you're not feeling well, you need preventative services, vaccines, lab work, or prescriptions. Student Health offers the most affordable pricing for these services. Students from other UC campuses can use our clinic, and UCSD students can access Student Health at any other UC with the same benefits system-wide. This is a student-only clinic. It's not open to the public or to the staff, so appointments and the availability is pretty good. Scheduling an appointment, you would do that by contacting the phone number provided or by logging into your My Student chart. Also, if you do dial this phone number, the 858-534-3300 number after hours when we're closed, a registered nurse will answer the phone and assist you with any ailment that you want to speak about and telling you which level of care you can access. If you need to go to an emergency room, an urgent care, or if you need to wait and schedule an appointment with one of the doctors at our clinic. We only bill the SHIP insurance carrier. We don't hold contracts with outside insurance companies. Students without SHIP or our RAFT, which I'll be talking about, may still use the clinic on a fee-for-service basis, meaning you're a cash-paying patient. If you are a fee-for-service student, the payment is due at the time of service, or charges will be transferred to your student account where you can pay them. Upon request, we'll provide detailed receipts to help you submit claims to your own insurance. Physician visits usually range from $89 to $159, depending on the services provided if you are paying cash. All students have access to mental health or behavioral health. The Student Health Clinic partners with the counseling and psychological services on campus. Haley's here with us today, and she'll provide more information on what CAPS offers on our campus. And I also recommend that you take a look at the CAPS website to find out further details. For students that have their own health insurance that meets our health fee waiver criteria, please file a health fee waiver on the Triton link during the open waiver timeframes. The waiver application is open to students now through September 14th, 2025. Please visit our website via the QR code to ensure that your insurance will be approved. There's a criteria that's set by the Office of the President for UC, and it's generally any plan that's offered in the United States that meets the Affordable Care Act currently. All waiver communications will be sent to the student's UCSD email, and that is our #1 means of correspondence on this campus, so it is important that you take a look at your emails and read them. Once a waiver is filed, it takes approximately 7 business days to be reviewed and to deliver a decision. So once you submit the waiver, it is tentatively approved, and then within the next 7 days, it's generally approved, denied, or they're asking you for more information. If you're denied, there is an appeal process. If your insurance doesn't meet the waiver criteria and you're denied on your appeal, you will have to pay for the UC SHIP fee, and you'll have to look into your insurance and see if it'll meet later on in the school year. We do open up the waiver about a month prior to each quarter, but the fall waiver is open currently right now for about 4 months. We have lots of helpful information on our website for the waiver. Please take some time and make a good informed decision about your healthcare needs. Waivers are not accepted outside of the waiver timeframes, and there are no exceptions. If you choose to waive the UC SHIP, I highly recommend enrolling in RAFT. RAFT stands for the Reduced Access Fee for Tritons. It is not an insurance. It's available only to students who waive the UC SHIP and have their own insurance. For just $70 per quarter, RAFT offers unlimited scheduled primary care physician appointments, in-house lab services and x-rays, flu shots, and is convenient because it's on campus as your healthcare option. There's no need for rides or off-campus appointments. RAFT gives you peace of mind with a predictable cost structure, a flat $70 quarterly fee. Without RAFT and without UC SHIP, single visits can cost around $160 each time you visit. As a parent, I absolutely would have my student waive the UC SHIP with my employer group offered insurance and sign them up for the RAFT without any hesitation. Should you need specialty care or medication, our team will guide you through the next steps. And the next steps you should be considering at this point is to decide whether you're going to waive or you're going to keep the UC SHIP as your health insurance carrier. You have to waive if you do choose to waive by September 14th. We will reopen the waiver for a late window from September 15th to the 20th, but there is an added late fee of $50 that you'll be charged. So please try to remember and avoid that. The fall quarter will begin on September 22nd officially, and that would be the first day of coverage if you are keeping the SHIP. Thank you for spending some time with us today. I'm happy to dive into your questions. If we don't get through everything, please feel free to reach out to us at ship3@ucsd.edu or join one of our Zoom options. We're always here to help. Follow us on social media, and please don't hesitate to say hello if you do see us around campus. I'm wishing you all the best during your time at UC San Diego. I'm going to send it to Annie, who's going to go over our health insurance health immunization requirements.
Thank you so much, Jill. My name is Annie Horton. I'm the Director of Nursing for Student Health, and I oversee all of the incoming health requirements for the university, and really just want to help make that process simple for you and to help avoid any academic holds. So we have health requirements to try and protect our entire university community. We're definitely seeing a re-emergence, unfortunately, of many of our vaccine preventable diseases because in the case of measles, the US has lost herd immunity. So we really put a lot of energy into ensuring that you have adequate immunity while you're with us and beyond. And we know that outbreaks cause significant academic disruption. For example, measles quarantine, even if you're exposed without full vaccination, can be between 2 and 4 weeks. So you can see that's a big chunk where you're not able to attend classes. So it's we really prioritize this before you come onto campus. The health requirements as they stand presently include all different vaccines and screening of illnesses and diseases that are spread through the air, because we know that folks living in congregate housing and studying in lecture halls and libraries, etc., are at higher risk of illnesses being transmitted this way. So the first requirement is tuberculosis screening, and every incoming transfer readmitted student is required to do this, and students transitioning from undergrad to grad. And the system will indicate whether you are considered at higher risk, and for those that are, TB testing is also required. The vaccines and immunizations that we require are our core 4 vaccines include Tdap, measles, mumps, rubella, chickenpox, and meningococcal. And we're putting a lot of focus presently on measles, mumps, and rubella simply because it is in at least 30 states in the US presently, and also we are seeing outbreaks in all different parts of the world at the moment. So we really want you to ensure that you have very up-to-date and current immunity for that. And then we have some seasonal vaccines that aren't due before you come to campus. They are due during the fall and winter, and that includes the influenza vaccine and the COVID-19 vaccine. These are both released as an updated version every fall, and earlier doses really don't offer much current protection, so we really want you to get the most up-to-date vaccine that is being released into the market. The first way to get started and also to receive reminders from myself is to ensure that you activate your My Student Chart. And to do that, you simply go into My Student Chart. There is a link on every page of our website, and I put our website link in the chat. You sign up, and once you just go in there one time, then that means it's activated. So we've already preloaded everybody into the system. You don't need any special logins. What you do need to use though is your UCSD student AD login, which you are given when you accept a position at the university. If you go in there and it looks a bit confusing and you're not seeing the incoming requirements, go back out and then come in and make sure you're using the student AD login. This is a door into the system that regular patients of UCSD Health utilize, and so we have our own special house within that community, and you really need to enter into the right door so that you see exactly what you need. Just some important dates, and for those incoming in the fall, is our tuberculosis requirement deadline and immunisation requirement deadline have both fall on July 14th. The academic holds go on for TB right at the end of July, and that is because for that requirement we are preventing active disease state from coming onto campus, whereas the vaccines are a preventative. And so for vaccines, we give you the beginning part of the full quarter to get any missing vaccines on campus or in local health providers or at retail pharmacies. And so submit as much as you have with your records or our forms. All of our forms are on our website. And then one of our team will will message you back and let you know if everything is complete or there is items missing and how to get compliant with the requirements. That's TB as well. So yeah, make sure after submitting your information that you come back and check regularly for messages, and also set up notifications so that you're text or emailed when we do send you messages. Just a little reiteration of student health services. As Jill mentioned, we have a comprehensive range of medical care. On campus, it's very accessible. We are right in the middle of campus presently. We are opposite Target on Library Walk. We offer primary and urgent care, and we have our own pharmacy, lab testing, x-rays, optometry, and nurses clinic. Nurses clinic is where we do a lot, almost all of our vaccinations and TB testing. So if you are using UC SHIP or opting into RAFT, which is, like Jill said, it's an amazing, very cost-effective way of receiving care here, even if you have your own insurance. And particularly, I think, if you have Kaiser, which is not entirely close to the campus, it's so convenient, and it covers all sorts of benefits, like being able to get blood tests and all sorts of things within our clinic. So I would really urge you to do that. And one other item I would like to draw your attention to is an app that you can download called Willow. This has been designed by the student body for students. It's a very innovative app that curates all of the health and wellbeing resources available to you as a student and recommends services, groups, activities, reminders based on your interests and needs. And it's really, really worthwhile. So I'd encourage you to download that app. So how to get help? Really the best way, within my student chart, there is on the menu, there is Ask a Nurse, Student Health Ask a Nurse. This is only available to students. And you can send our team a message there. You can expect a response mostly within 24 hours. We have a big team of nurses responding to those messages during office hours, as well as outside of office hours and weekends. Sometimes around hold dates and deadlines, it might take a little bit longer to respond because we are receiving so many at that time. If you are having technical difficulties, I do have an email address there that goes to our medical records, and we will help troubleshoot if you are having issues. Please don't send any medical information through that email, though. It's not a secure and safe way. Please do that all within my student chart, which is a very secure platform. As I mentioned, absolutely everything is on our website. Please, after this, go and take a look. All the forms, how to sign up for my student chart, link to my student chart, anything to do with medical exemptions, just absolutely anything you could think of, go there first and take a look. And I've included lots of individual vaccine information, including common brand names, both local and international, to help you decipher your own vaccine records. And I would really, really encourage you to complete your requirements as early as possible to avoid enrollment holds. So that is the consequence of not getting your health requirements done, is that a hold is placed on your account, which prevents you from signing up for classes. And so for the TB holds, that will prevent fall enrollment. For immunisation, that will prevent winter enrollment. So it's really, really good to avoid that. However, if you do get one, not the end of the world. Just doing your requirement will enable the hold to lift within 24 to 72 hours. So just keep going on that. And as you can see there, we've got a big team of nurses, and we also have a team of medical assistants that are also assisting us. But we have been doing this for many, many years, and any of us will be able to help you. If they can't, they will forward it to myself, and we will be able to help you with any questions or concerns that you have. And the last slide is just really all of the different ways that you can contact us and our social platforms there. So please feel free to link in and see what our offerings are. And that is it. So if you have any questions, please feel free to put them in the Q&A or send us a message in Ask a Nurse. So thank you, and we're looking forward to seeing you in the fall. And I'm handing it over now to Hallie.
Thanks, Annie. Thanks, Jill, before that. My name is Haley Wright. I'm a licensed clinical social worker and therapist at CAPS. I'm going to go over our mental health services here on campus, and I'm going to share my screen in just a second.
As Haley's loading that up, I will share to Annie's, one of her points is making sure that we're getting things in before the deadlines. So the first one coming up is going to be on July 15th. And while that hold does come off of your account within that 24 to 72 hour period, folks in that 24-hour period are pretty stressed. And it isn't necessarily, it might be a 25-hour or it might be that 26th hour. So if you're here, you have 20 days before that's due, I really encourage you to sign up to start getting your TB test done and getting your vaccines to save yourself some stress later. So just really reiterating that point. And then so sorry, Haley.
Needs to apologize at all. That's super helpful information, and I think students will appreciate that as the year gets going. Okay, as I said, my name is Haley Wright, and I am with our counseling and psychological services. I happen to be also the transfer student liaison, so you'll oftentimes see me in the Try and Transfer Hub doing some collaboration work with the hub, being the transfer liaison. So what do we do at CAPS? Again, you'll hear people commonly refer to us as the acronym CAPS, but again, that stands for Counseling and Psychological Services. So a big part of what we do is counseling, individual and group counseling. We also offer psychiatry services. So that's one of the really great things about students who need therapy and medication, is that they can have that all done in-house. That's one of the things that I think is really awesome and appreciative, is that you don't have to worry about necessarily getting a referral if you're being seen with a therapist at CAPS. You can also see a psychiatrist also embedded in there. We also offer psychological testing, which is a huge benefit to our students. For students who are coming to our campus and finding that they're having some academic challenges that they believe might be related to perhaps a neurocognitive disorder, psychological testing can be very helpful with them receiving accommodations at the Office of Student Disability. So that's something that we offer to our students that is free to them to access the testing. And then our services are completely free and confidential, meaning that we do not take, we don't take insurance for you to be eligible. We're different than our sister over at Student Health Services, where they do involve UC SHIP. Our services are actually covered through your student service fee, and that's something that's kind of embedded with your registration. So I'm sure as you're registering, that gets paid. That covers our services. We're not looking for any eligibility with insurance, and we don't have to do any copay to see a therapist at CAPS. Okay, and then it's important to know also that our services are confidential, right? Even though we are embedded on the campus, we are not in communication with professors, with coaches or anything like that, unless you would want that, and that would be a signed permission that you would give us that permission to do so. Otherwise, this is part of your health record, the same place that it would keep your information about if you go to the doctors for, a heart condition, your medical or your mental health record is also protected under that as well. So that's important to know, is that it's free and confidential and is separate from the academic side of things. Unless, again, you would like for us to have an opportunity to speak to a professor to advocate on your behalf, or speak to the dean of student affairs to advocate on your behalf and explain kind of how maybe mental health is impacting you. Okay. Reason students come to us. I like this slide because I oftentimes hear folks say, well, I don't know if my concern is big enough, or, is something that needs to come to CAPS for. And really, there's no thing too small or too big to come to CAPS. We want you to come and reach out if you feel like you could use some support with mental health. As you can see, there's a wide variety of things that students come to us for. Adjustment to UCSD is something really big for transfer students, but all of these things can be co-occurring. And so, whatever you're dealing with is not something that we haven't seen before and that we are happy to help you with. Okay. And then sometimes if we feel like what you're dealing with would be better served perhaps with a different model, then our CAPS model that will actually help connect you to that level of care that's appropriate. So we're definitely the first stop to come through with mental health concerns and kind of help guide you to what's the next step. Okay. Also, we offer crisis services. This is also really important that our community knows this. This is available to all students, whether you have a therapist at CAPS, whether you've ever come and spoken to us before, you do not need to do that. If you're experiencing a mental health crisis, this is available to you as a student. We have in-person and video options to speak with one of our CAPS clinicians on duty, and that was during our business hours of 8 to 4 p.m., Monday through Friday. And then we also offer support after hours in the crisis line. So you may speak to a crisis clinician just by contacting us by our main number. We have one number that gets you to everything, and you can see that on the screen. It's on our website. If you're having a mental health emergency as a student on campus and registered, you can call that number and someone will answer and kind of direct you in the right direction for what could be helpful. Whether if it's during office hours, you can maybe come in, or if it's after hours, you'll still speak to the crisis clinician and someone from CAPS will follow up the next business day. Okay, so very important. We have students call and consult about other students that they're concerned about, like a roommate. We are happy to hear, support, and send you in the right direction. If students themselves are experiencing any crises, perhaps they're having thoughts they would want to be dead, we would want them to give us a call so we can help talk to them and support them and get them the support that they need in the moment. Okay, so again, completely free crisis services available to you 24/7 by calling that phone number. Okay, outside of our individual therapy and our crisis services, students can also engage with us through our RISE workshops. And so these are really great opportunities to build skills and to grow in different areas, connect with other students. And then I go to this next slide, you'll see the different options. But this is great for folks who want to work on maybe something specific, but they don't necessarily want to commit to going to therapy for the quarter. They just would like to get help with something specific. So for example, we have sunrise session, which is incredibly popular. It involves yoga and it's done at a time that's said sunrise, but actually it's sunrise for college students, which is I believe 10 a.m. is when they end up doing it. So no need to get up, what we might think traditionally sunrise. It's extremely popular. It's connected with rec. And then also each quarter they do a really cool event where they've done it at the aquarium here, the Birch Aquarium. They've done it underneath the stars somewhere on campus by Library Walk, I believe. And so that's really great. Performance Lab is an awesome opportunity if you are looking for ways to maybe work on procrastination and sort of get that under control. If you need help with sleep, it's very common for college students to have that sleep schedule out of whack. And once you've pulled too many all-nighters, it's a little bit harder to rein it back in. So we actually have a workshop specifically on that. Mindfulness is a word I'm sure you all hear very often now these days. You may not have a complete idea of what that is. This is a great opportunity to practice mindfulness, learn how it can be effective for you. Restorative movement is great for for appreciating your body and the way that it is able to move. And then stress better, we also have it's something for students who we understand that stress, eliminating that's not necessarily a possibility as a college student, but we want to give you skills for how to kind of keep that at bay and make sure that it's not affecting, not having the opposite effect where now it's impacting your academic functioning, right? And then we have Triton Rise with Outback, which I will explain a little bit more, really cool program as well. All these services completely free. And again, you don't have to be in regular therapy with us to partake in these. And then, as I was saying, there's the CAPS Rise with Outback. This is super cool. This is where CAPS partners with Outback at Rec, and what they do is different activities in in nature, in the community, with a mental health combination with also again connecting with nature. So you'll see in these pictures we've done nature walks on campus. They've done paddle boarding. I believe that there's paddle boarding with, I don't think it's yoga per se, but there's mindfulness involved in that. And then we have a challenge course on campus, if you're not aware of that, which has an opportunity to do the Great Leap of Faith. And that's an opportunity, kind of what it sounds like, to go up to a very high part of the challenge course. And then you are harnessed and protected in and safe, but you get to practice the leap of faith, right? And that's really great about overcoming fear, as well as you can practice calming your nerves. So we have this combination with outdoor rec activities and mental health. We also offer a camping trip once a quarter, usually on the long weekend, completely free to our students, where two CAPS clinicians go out with 2 Outback staff and about 10 students, and they go to different campsites nearby, and they work on social anxiety, improving general anxiety, while also in nature, and do a lot of great activities and hikes. And again, it's very awesome that we're able to offer it completely free to our students if they do choose to do that. They are able to rent free all the camping equipment. So we have a couple of opportunities, again, to connect with mental health in different ways if, again, individual therapy is not necessarily your jam. And then perhaps what you are looking for is not necessarily to work on a specific issue, but you just feel like you could use some support and connection. And again, this is something that tends to be very important for the transfer community, is finding that connection on campus. And so we have lots of ways for students to connect. You have the Triton Transfer Hub, and that, as Tessa was saying, they do lots of great events to connect with transfer students specifically, but perhaps you want to connect with other folks who've sort of, embraced sort of your intersectional identities, not just being a transfer student. We have these opportunities as well. So we have some that are open to all students that you can attend, and then there are some that are specific for graduate students. However, most of our programs, if it was offered a graduate student, most of them are offered usually at undergraduate, so you don't have to worry about that too much. What's awesome about these is that they have weekly offerings, and that they're drop-in. You don't have to necessarily commit before, or you have to commit to the whole quarter, come to one, come to many, it's completely up to you. All students are welcome to go to any of these connections, and I can't stress these enough, especially for building community, to check out these events. A lot of them offer food, and it can be really yummy as well. So do know that that's available to you if you're just looking to find some connections with other students who have shared experiences with you. And then this is also really something that we like to be able to highlight and offer, as we have our co-curricular well-being certificate. So I've told you about all these different opportunities to improve your well-being, and you may say, well, what's the benefit other than my well-being? But also you can get what's called a co-curricular record, where you have basically a certificate that shows, it's part of, kind of goes alongside your academic record, but that shows and validates that you have been working on your well-being, and you've been doing that and by participating in some of the activities that I mentioned. And so this can be very helpful when we talk about how to be competitive, when you're trying to apply for internships or even graduate school, just kind of show that, like, not only am I, doing well academically, but I also really invested in improving my personal well-being. And that, again, it's validated. It has some separate little certificate and record. And so that's another benefit to attend our programs, is not just for the in the moment relief, but also if you'd like to kind of sort of build up your sort of transcript and have that opportunity. So attending 12 activities for the whole academic year, which really could be like 4 out of, if you want to do it equally for a quarter, or, and there's 10 weeks in a quarter. So you can totally spread it out. You just do a quarterly reflection, and hopefully that's like another incentive. You can use a little QR code there if you want to read more about what is this co-curricular well-being certificate. And then what's awesome is that we offer Headspace. So the UC San Diego campus pays for students who are enrolled to have access to the premium membership of Headspace. For incoming transfer students, that is something that usually becomes available usually about like the second week of the quarter. You have to give it a second for whoever does upload or enload like the everyone's email addresses. So that usually for the new incoming students can take maybe 1 to 2 weeks into the quarter, but this is a really great opportunity. I like to say, if you've got the data space on your phone, to download the Headspace app, because again, you get the premium membership completely for free. And, I also like to share with students, it's like, you may be really struggling before a test, and it's like not an appropriate time to call your friend, and you don't have a therapy appointment, but you're really stressed before a test. And so you could put on one of these mindfulness meditations or an anxiety meditation and just sort of get that relief in the moment. Or maybe you just finished studying, it's 3 a.m. Again, probably not going to call your friend, and you're not going to have your therapy appointment. You might do a sleep meditation, right? And so I think it's really helpful to have that on your phone to sort of empower you to take your mental health into your own hand and work on self-soothing yourselves. Just kind of right there, everything's on our phone these days, so should our well-being, right? So completely free, and you can sign up on our website for that as well. Great. And then, as they said, these are again just some other points about the Headspace app: 1,000+ hours of mindfulness and sleep content. Right? I know some people use there's like a musical, like kind of maybe like instrumental music that people use when they're trying to study. So that's also really cool. Great. And then this was mentioned earlier, the Willow app. Again, CAPS also benefits from students seeing the Willow app and activating with the Willow app. And by that, I mean that you are kind of getting awareness of our activities and awareness of our program. So it's a really great opportunity if you feel like, I know I could use some support, but I don't know what is out there, and I'm just inundated with everything. The Willow app is something that was created by UCSD students, and it's for UCSD students in mind. It's completely free, and it's a great place to source where you might need what direction to go to work on your mental health. So for example, you might say like, oh, this is how my mood is, or this is what I'm feeling. And it sort of points you to like, have you tried going to this, workshop or something of that nature? So it's kind of your all-in-one app. You want to do some things with your well-being, you need a little bit of guidance. So as mentioned earlier, the Willow app is really great for that, and great to sort of see what services we have available. And then, as you can see, it's based off of the dimensions of wellness. And so these are the way that the app was created, was to sort of have collections and resources to align with your preferences and sort of point you in the right direction based on what you're experiencing. Right? I know sometimes when we're looking for support and help, it can feel really overwhelming of where to begin. So I think it's helpful to have technology kind of help narrow that down for you. All right. Getting started, maybe some of the things that I mentioned to you, you are interested in pursuing. And so I want to let you know, how do you kind of get started with us. So the way to do that is to contact us by phone. Again, this is when students are completely enrolled for the beginning of the quarter. And that number is our main number. It's for everything, the crisis line and just for routine services. So you can give us a call there. You can also, when the fall quarter starts, request a call back from our front desk team within your My Student Chart, and we can reach out to you because perhaps maybe you don't have a great time to talk on the phone right now, but you want to kind of get the ball rolling. I think it's really great that you can go on your My Student Chart and request a call back. And then what happens from there is then you'll get set up with talking to one of our clinicians to see and help direct you to what's the best support for you for your mental health. That might be at CAPS, and then that might also be a referral off campus. Again, as I said earlier, there are times when we feel that it's best to be served off campus so that you can maybe receive longer term care, or you can be seen more frequent than our CAPS visits. And so we will help you get connected. We aren't going to just sort of say you're on your own. We will help you get connected so you have that warm handoff. As a reminder, we offer individual counseling, group counseling. We also offer couples therapy, which is great. And then urgent care services available by phone. And then the workshops, community connections, and iFlourish is again what our headspace is under. So that is all of our things. Our website is a great site for that, just caps.ucsd.edu. It's a great place to sort of explore and see from the cool flyers and the things that we've talked about. So I am opening myself up to questions. I know we're going to probably have a question section, so I wanted to say also thank you everyone for listening to that.
Well, thank you so much. That was so much good info from so many different corners of health that are all so important. I'm going to just go back over a couple of frequently asked questions. Our Q&A box is so tidy and all of our questions are answered. Y'all have been so on it in there, so that's wonderful. One of the questions I have here is, if I do not get UC SHIP and I waive UC SHIP, am I still able to access student health services on campus?
Good question. So yes, every student of UC is welcome to use the services at Student Health. You are either on the SHIP, RAFT, or you're paying out of pocket for the services. And we will give you a receipt with itemization that you can send to your insurance for reimbursement. And our prices are very low, so you'll probably get paid back almost 100%.
And then I'll ask the same question. If I waive UC SHIP, am I able to access CAPS on campus?
Yes, as Haley indicated, and sorry to jump ahead, Haley, but you are paying a registration fee to access our mental health on campus. That is not a payer-based situation. It's part of your tuition. So yes, every student may access CAPS.
Perfect. And does that go for all the RISE activities you mentioned as well?
Everything in apps, everything in CAPS is all inclusive. And again, as Jill mentioned, it's under that student service fee that's already paid for. So it's great things.
Thank you so much. I also have a question here of, where can I locate my vaccine records? And then what if I can't download it or get an official copy? How can I get that to UCSD?
Sure. Yeah, so the place to check is any existing electronic medical records that you have a log into. That's a really great place. Immunization registries in your community state, they will often be a repository of all of your vaccines. Previous high school or colleges that you have attended are also other places, as well as your parents. They usually have records of childhood vaccines tucked away somewhere. If you are completely unable to locate any past records, then our recommendation would be to take our form, which is available on our website, to your current healthcare provider. They can run blood tests on measles, mumps, rubella, and varicella to see if you have existing immunity or not. They can give you any vaccines you haven't had as a result of those tests, and they can also give you an updated dose of the Tdap and the meningococcal. And we do have many students that fall into this category, so it's a common way to have to approach it. So yeah, great question.
And if I have access, say on like my Kaiser app or another area, am I able just to send a screenshot in, or do you need it to be more formal than that?
No, you can send any record as long as it's got 2 identifiers on it. So even if you print out of any sort of My Chart Epic app, it'll have your name and date of birth. So we really do need 2 ways that we know that that's in fact your record. But yeah, any type of, like, you can take a screenshot of your yellow immunization card, of any sort of little book that you've got with all that detail in. We get all sorts of screenshots with people's pets in the background and mum and dad eating dinner, and so just go ahead as long as we can read it and understand. It's totally fine.
And then last question I have here is, can I use student health services to get any vaccines or blood tests that I might be missing? And how might that impact me academically?
You can, we allow up until November 1st to get fully up to date with all your vaccines. You can get any of the required vaccine. In fact, almost every vaccine on the market, the nurses clinic has for you. If you are opting into UC SHIP, that is all 100% covered. It is not covered under RAFT, but you can get those mostly done at any retail pharmacy. If you need blood tests, that's included in RAFT. And we also have a lot of students will use us simply because it's convenient and choose to pay out of pocket, especially for those quick turnaround. And we have a fast track clinic that we run that you can come in and schedule online. They're 5-minute appointments, and you can get Tdap, COVID vaccine, influenza, and HPV. HPV is not required, but many students like being able to get access to it here conveniently. So that's also an option.
Oh, wonderful. We are 10 minutes ahead of schedule and all our questions answered. So we are just overachievers today, and that is wonderful. Thank you, all of you, for the wonderful information and answering all our questions here, and for being back with us again this year. With that, we are all set to wrap up for our session. And for folks who've registered for STEP, we will work on getting you the recording and notes within this next 24 hours. Thanks so much, everyone.
Thanks,
Thank
Tessa,
you.
for the opportunity.
Thank you.
Bye.